I hope you all are doing great. In today's video, I am going to discuss about the troubleshooting for HNE staining. Now, for troubleshooting, first we have to know about the basic steps of staining. These steps includes the first step is the deparaffinization, which is around 10 minutes in xylene with 3 changes. Then the second step is the rehydration of with graded alcohol around 1 to 2 minutes with 2 changes. Then the third step is the nuclear stain, which is done by the hematoxylin for 5 to 15 minutes. Then the step 4 is differentiation, which is done by 1% acid alcohol, 2 dips and wash. Then the fifth step is the bluing, which is running under tap water. Then the sixth step is the counter stain, which is eosin Y for 2 to 3 minutes. Then dehydration. Then the for the with graded alcohol for 3 to 5 minutes each. And last step is the clearing and mounting daily for about 5 minutes. This is technique used in histo. Now we also use the hematology H E stain in cytology also. For that we first have to rehydrate the prefixed slide in trolley in water around 1 minute. Then the we have to put it into hematoxylin for 7 minutes. Then we have to remove it and put the trolley in running tap water for 5 minutes. Then differentiate with by 1 dip in acid alcohol. Then remove it and put trolley in running tap water for 5 minutes. Put into the eosin for just 10 seconds and give 5 dips in running water and mount the slide with the DPX. These steps are almost similar, but the duration are somewhat different than the we have seen in this histo staining technique. But the basic steps, which is the rehydration followed by nuclear stain followed by differentiation, bluing, counter stain, dehydration, clearing and mounting, will remain the same. Okay. Now the results of HNE stain. We will see the nuclei RNA-rich cytoplasm with blue or black color, cytoplasm with varying shades of pink, then the muscle fiber pink or red, RBC orange or red, fibrin deep pink, fungal hyphae faintly hematoxyphilic, calcium deposit deep blue black, and keratin bright red. Now the outcome of HN stain. Generally this is the excellent for morphology and useful for the contrast. It is the particular strongly disclaimer color of cell nuclei and cytoplasm. Recognition of extracellular tissues like fiber, bone, cartilage. Then the general morphological backgrounds and the avoidance of overstaining and stability of staining pattern in mounted section. How does the HN stain relate to an ideal routine histological stain? It is most commonly used and ideal also. So its characteristics are the chemistry of the components should be known. The stain component should have reasonable solubility and stability, which is seen HE. Then the limited dependence on tissue damage is less. Then the dependence on fixation is also less. Minimal sensitivity to carry over water. Duration of staining is also less. Information on mechanisms should be available, which is available in H&E. Long shelf life, absence of any toxic components, and cost effectiveness. These are for makes the H&E stain is ideal for the routine staining practices. Now, our main discussion is on troubleshooting. Though the problems we will get after the staining are common as the pale stain nuclei, dark stain nuclei, or reddish brown nuclei. Now, for in pale stain nuclei, possible cause may be there is too much differentiation, so we have to stain it in hematoxylin again. If too less time for hematoxylin, then we have to keep in hematoxylin for longer duration. Due to excessive decalcification, the decalcification is not possible to correct. We have to use properly calcified sections. Hematoxylin is over oxidized. We can change the have to change the hematoxylin solution. These are the causes of pale stained nuclei. For darkly stained nuclei, it might be due to the short differentiation or too much time in hematoxylin or thick section. For short differentiation, decolorize and do the optimal differentiation. If there too much hematoxylin, we again have to decolorize an appropriate time. In thin section, we have to recut the thin section if the section is thick. Nuclei looks reddish brown. It might be due to insufficient bluing or hematoxylin is degenerating. For insufficient bluing, we have to restrain giving the more time in bluing step. While if degenerating, we have to check for the oxidation status of hematoxylin. So these are the troubleshooting of nuclei. Then we go for the cytoplasm. Pale color cytoplasm by eosine might be due to the too thin section or the eosine solution has pH more than 5 or too much dehydration. If the section is thin, we have to recut. If the pH is more than 5, may be due to the dilution, bluing solution, check for the pH. And if the dehydration, do not keep sliding alcohol for a long time. Now, if the water bubble seen in the section, the possible causes might be due to the incomplete dehydration. So remove the mounting media cover slip and keep the section in absolute alcohol for the further dehydration to avoid the water bubbles. Now, other problems are the bluish black precipitate. It might be due to the precipitation of hematoxylin. For that, we have to filter the hematoxylin. Staining is irregular and spotty improper due to the improper deperoxidation. To keep the slide in xylene for longer period, as we seen, is which is the first step is the deparaffinization. Dark blue stain at the edge of tissue sections due to heating artifact or for using electrocautery. We don't have any solution for this particular problem. Now these are the problems which I have discussed. This section is showing the pale nuclei. Then this is showing the two dark nuclear stain. We already discussed the possible causes and their troubleshoots. This section is showing the incomplete deperoxidation, which is the first step of histology stain of H and E. We have to proper deperoxidize the section. The cytoplasmic staining is too dark, seen in this section. Then this shows the weak staining of eosine and the uneven staining. Thank you.